Hello and welcome to the very first episode of The Dental Connect. The Dental Connect, where we go beyond just the dental smiles or the dental aesthetics. Yes, we talk more about the relation between the oral health and the entire body. Hi, I am Dr. Ishita Jakhanwal, prosthodontist and oral rehabilitation expert, and I am thrilled to have with us today with us a very special guest, Dr. Suhasini Jadhav, proctologist and gut health expert from Pune. Welcome, Dr. Suhasini.
Yes, thank you, Dr. Ishita. Thank you for having me on your podcast and giving me this opportunity to talk about the topic which is very close to my heart, gut health. Thank you.
It's all my pleasure. Thank you. Let's start with the basics, Dr. Suhasini. I always tell my patients that any systemic condition starts with oral health. As we all know, the entry to your gut is the mouth. What is your take on this? What is the connection between a poor oral hygiene and gut condition?
Yes, Dr. Ishita. So, mouth is usually considered as the first organ in digestion, and poor oral hygiene, missing tooth, gum diseases can lead to disruption of gut microbiota, poor digestion, which can eventually lead to constipation, bloating, nutritional deficiencies, etc.
Absolutely, Dr. Suhasini. Thank you for putting up so well the real connection between the oral health and the gut health. Dr. Suhasini, I see many of my patients, especially the elderly patients, but very often even the young adults, they delay in the treatment procedures, dental procedures like replacement of missing teeth. And they just say that we manage with soft food like khichdi, upma, or even they stay on liquid diets. So what do you think that these kind of diets, how can they affect their gut health or overall body?
We will manage kind of diets are mostly soft foods.
Absolutely.
Okay, and
Absolutely.
these soft foods, they are high in carbohydrates, low in fiber, and which can eventually lead to body inflammation, disruption in the gut microbiota, leading to insulin resistance, which can in long term cause metabolic diseases like diabetes, BP, and obesity as well. So like we should stay away from this we will manage kind of diets altogether.
Very true. This looks like much more than just gut health. It can affect to much more than gut health. For example, she said obesity and conditions such as even mental health. Thank you, Dr. Suhasini, for putting it so well. Another point that I see is emotional. Yes, many of my elderly patients, they start losing confidence when they start losing their tooth. Dr. Suhasini, do you have a similar experience with these kind of elderly patients?
Yes, very much. So social isolation, depression, irritability, usually called as old age symptoms, most of the times they are triggered by loss of dignity in eating and poor nutrition. As I always say, eating is not just digestion, it is an identity, it is a joy, and that joy must be preserved.
Absolutely, absolutely. Eating with friends, family, and in social events is equally important for even the elderly patients. Why geriatric dental care is gut care? Dr. Suhasini, to you, my next question is, why do you think proper replacement of missing teeth is important and not just relying on soft diet can manage?
Yes, so proper chewing is very important as it can trigger enzyme secretions, it can maintain the gut motility, and also gives the brain the signal of feeling of satiety, which is feeling of fullness. So poor chewing can lead to poor digestion, poor absorption of the nutrients, and ultimately faster aging. That is the reason why.
Thank you, Dr. Suhasini. That was very well and briefly explained why replacement of missing teeth at right time is important. Did you even know that poor digestion can cause something called as GERD or gastric acid reflux, which can cause dentinal hypersensitivity leading to more tooth decay?
So gastric esophageal reflux disease is basically chronic acidity, and this acid coming up in your mouth causing erosions to your teeth, gum disorders, and also ulcers sometimes.
Absolutely, absolutely. That's very true. So, Dr. Suhasini, what would you advise to the caregivers of elderly patients? How to take care of their oral health?
So there are three things. One, don't ignore the tooth loss. A good prosthodontist can restore the chewing function at any age. Second, don't rely only on chai and biscuit. Make sure that you're giving vegetable purees, uh, oats with seeds, etc., which are basically low in carbs and high in fiber. And third, don't ignore gut health. Keep a close watch on it, as chronic acidity or constipation is not normal with aging and is a sign to act.
So, actually, I like to share a patient's experience with you, as we are talking about effect of eating soft food and not chewing a proper diet, not having a proper diet. So there is one patient of mine who has been visiting me since last around 6-7 years. Initially, she was managing with removable partial denture, removable dentures which can be taken out and worn by the patient herself. So it was not a fixed dental treatment, but she was managing with that kind of treatment. But eventually, after 2 years, 3 years down the lane, she understood the problem that she was facing. She was not able to chew the proper food. She was not able to get that proper satisfaction of eating proper food. And as you described, the bloating problem, the digestion problem, so all these things she started facing, and eventually after 2-3 years she came back to me, and she absolutely was convinced that she wanted to go for a permanent fixed dentition, and she was ready to take that step. So taking that step, I think, is very important for everybody. I think there is there's a barrier between ye chal jayega, chalta hai, I can manage with this kind of food, and the realization ki nahi, this is not happening.
So what happens many a times, I see it in my practice, they're coming to me for chronic acidity and constipation, and sometimes nothing is actually wrong.
Yeah, absolutely.
And if I dig in, like if I take proper history, I see that they've been given some removable kind of dentures.
That's
and
right.
then they have these ulcers.
That's
and
right.
then they
That's right.
avoid using them, and
That's
again
right.
leading to dependency on the soft food and eventually the gut health issues.
This is
Now,
very common.
yes. So I usually refer them to a good prosthodontist just to take care of the oral health, because I cannot bombard them with medications.
Absolutely.
End of the day, it is important that the digestion needs to be improved. For that, the lifestyle needs to be improved, and definitely I think the newer implants and newer technology makes it so easier for them to have like good implants.
That absolutely, it depends. I'm not saying that removable partial denture is not right and only implants is right, but depending on the condition, if depending on the bone health, and if it can be done,
But
if for
it
the patient it can be
also
done,
makes a
I think
difference if it is done by a specialist.
very much, very much. A proper planning, a proper diagnosis,
Yeah.
and a planned treatment is very, very important, because it is not only about doing something for right now. We have to do something which is going to last a lifetime. It is something that we are building foundation over. Just thinking about like a building, we are building a good foundation over which something has to stay for years to go.
I think
So
a holistic approach is important over here.
that's very true.
Right.
That's very true. And what you spoke about, that wires with dentures. So that is the reason why patients feel very discomfort with removable kind of prosthetics. Nowadays, there are advancements in removable dentures as well. Like without, there are flexible dentures also available without any wires or anything. But nothing can replace a fixed option. If possible, if patient's systemic condition, bone condition, and health condition accepts the treatment, then nothing like it.
But again, there is so much of lack of awareness nowadays. That is something which I feel is a bigger problem.
I think that was the reason for starting our podcast.
Yes,
And I think it should help more and more people to know about to aware the people about what treatments and what is the connection between oral health and the entire body. So I think this awareness will increase, and with small steps that we are taking
Yes,
today.
yes,
Thank you, Dr. Suhasini. It
yes.
was
Thank
wonderful
you,
having
Dr. Ishita.
you with us, taking your time out with us, and it was a wonderful session. Thank you to our listeners. I'm sure that this podcast was very important for everybody here, because it actually bridges the gap, and it brings about two very important specializations, that is a prosthodontist and a proctologist, how it brings the real connection between the dental health and the gut health. And we see that is not only about beautiful smile or aesthetic smile, or only about indigestion or bloating. It is much broader and beyond what we think.
Absolutely. So, mouth is the entry gate of our body, and if the gate suffers, everything downstream suffers. So, as specialists, it is important that we bridge the gap and also educate our families. Again, aging is natural, but suffering is not. So, with proper dental care and digestive care, we can help our elders in the household live with dignity.
Absolutely. Do not forget regular dental checkups and regular gut health checkups, and share this podcast with your friends and family. I am Dr. Ishita Jakhanwal, prosthodontist and oral rehabilitation expert.
I'm Dr. Suhasini Jadhav, laser laparoscopic and bariatric surgeon from Pune.
Do follow us, like and share our podcast, and do share with your friends and family.